We are happy to welcome you to this ISN webinar, which will be dedicated to the ISN Education Ambassadors Program. My name is Denka Hušková. I'm a nephrologist from General University Hospital in Prague in the Czech Republic, and it's my great pleasure to have the opportunity to guide you through today's webinar. First of all, I would like to comment on the app that's available to you. You can use the Wordly app that's hidden in the right hand corner, and you can use translations to your own language if you wish, or subtitles for the English version of this webinar. We will first introduce the Education Ambassadors Program, and I'm very pleased to have the opportunity to introduce today's leaders of the Education Ambassadors Program Committee, Vincent Lee, who is a renal physician from Western Hospital from Australia and the current chair of the Education Ambassadors Committee. So welcome, Vincent. And Ahad Kaum from Lahore, from Pakistan, who is the deputy chair and renal physician working in Pakistan. Welcome, Ahad. In the first part, we will hear some general information about the Education Ambassadors Program. In the second part, we will have an opportunity to hear personal experience. And I'm very glad that our invitation has been accepted by one of the successful applicants, who is Khalida Soki from the Nairobi Hospital in Kenya. Welcome, Khalida, to the webinar. And even though Avnish Kumar has not been able to join us today, we will hear some ambassador's point of view in his pre-recorded speech, and I'm very grateful that he was able to do so. So without further ado, we can start now. Vincent, please go ahead. Thank you.
Thanks, Zdenka, and good morning, afternoon, or evening to everyone. The International Society of Nephrology, the ISN, has been supporting nephrology worldwide since its inception in 1960. The ISN advances worldwide education, science, and patient care in nephrology. Much of this is done through its grants program, which directly supports ISN's members throughout the world. And examples of these include the Fellowship Program, Sister Renal Center Program, Continuing Medical Education Program, the Clinical Research Program, and many, many others. The ISN Educational Ambassador Program was established in 2009 to support educational ambassadors who are experienced nephrologists with specific skills to go to a nephrology center to provide a training program. Since inception, the ISN Educational Ambassador Program has helped some 125 institutions in 56 countries benefit from hands-on training courses. The program may be focused on a specific subject, for example, interventional nephrology, pathology, transplantation, or peritoneal dialysis, and it's delivered face-to-face such that hands-on practical training is provided. The educational ambassador is usually identified through a pre-existing relationship with the host center. The Educational Ambassador Program complements the other ISN programs. So, for example, nephrologists who have graduated as ISN Fellows through the Fellowship Program have returned to their home country to establish new programs. As part of upskilling these programs, an educational ambassador can be invited. Sister Renal Center participants can also organise an educational ambassador visit in continuation of or as a follow-up to specific initiatives funded by the Sister Renal Center program. So by ensuring that specific renal training needs are addressed by the best available experts, the ISN hopes that this program can fulfill its potential to having an immediate and tangible impact on renal healthcare services in low-resource countries. Funding from the Educational Ambassador Program generally goes towards funding costs, such as travel and accommodation for the Educational Ambassador. So this webinar will showcase the impact of this program and provide a fantastic example of how it has supported nephrology. The Educational Ambassador Program has an easy application process, which you can find online at the ISN website, and you'll see the link on the chat. And the ISN office, and in particular, the Senior ISN Program Coordinator, Mara Rodriguez, who is also online for this webinar, they are very happy to assist you in this process. Applications are accepted all year round, with educational programs having a flexible design, sometimes with online components in a hybrid design, can involve educational ambassadors traveling from one region of the world to another or within regions. So it's important to note that the Educational Ambassador Program is available to all ISN members. And this particular slide just highlights some of the things that I've just talked about. So I'll now hand over to Ahad to talk about what is the impact of the Educational Ambassador Program on nephrology care worldwide.
Right. So, thank you, Zdenka. Thank you so much, Vincent. Hello, everyone, and thank you for logging in. So taking off from what Vincent has actually very aptly described as the aims and objectives of the Educational Ambassador Program, it gives me immense pleasure to sort of highlight and show you the impact that it has, largely through capacity building, where we fill in the gaps in the practice of nephrology in areas of need, and we do this through specific skill set development and service creation. So as Vincent has already said, it can be anything ranging from point of care ultrasound to renal histopathology, development of palliative care or conservative care, to something like pediatric nurse collaboration as well. It's largely a global program. So countries ranging from Pakistan, Benin, Kenya, Georgia, Nepal, Malawi will come to more countries later. So we've already had quite a few impact there. And once the fellowship or the 7 to 8 days sort of workshop is completed, we do a post-workshop feedback as well. And then we go back, as Vincent said, after 1 year. And it's been very, very interesting to see the feedback and the improvement and the impact that this program has had. Okay, let me just go to the next slide. All right, so this slide is actually what Vincent was alluding to. This is actually the link where everything is there. It's very comprehensive. We've got videos there as well, in which it will help you in sort of finding out how to fill out an application and also what are the do's and don'ts. And of course, you can always reach out to us. Vincent's there, I myself is there, and of course the coordinators Eugene and Amar are there as well. I would just like to highlight at this point that this program does not have a deadline. So it's like 365 days a year. So you can apply whenever you feel the need, that this is something that we're lacking in, and this is what we want to do. Let me just move to the next slide. Yes. So again, going back to that, this is a global program. We've had lots and lots of success stories, as you can see, ranging from Uzbekistan to going to South America in Peru, where we worked with their regional societies to develop a vascular access program, to boosting peritoneal dialysis in Bangladesh, and then moving on to Romania, where we did a histopathology workshop. And then I'm very, very personally indebted to this program as well, because they started the POCUS program in Pakistan earlier this year as well. So one such program, a shining example that I would like to say, is the one that concluded recently, based out of Nairobi, Kenya. So this is just one of many, shining examples in which the Dr. Khalda Soki, who is the host consultant and chief of nephrology at the Nairobi Hospital in Kenya, invited Dr. Avnish Kumar, who is based out of Sheffield Teaching Hospital in the United Kingdom, because they wanted to improve their renal transplantation services. And actually, they already had it previously, but they wanted to kickstart it again and also look into how they can do AV access care better. So without further ado, on my part as well, I would like to invite Dr. Avnish Kumar, who is a specialist renal transplant and vascular surgeon. He's a trainer of international repute, to sort of take over and describe how and why he was a part of this program and what were the success stories behind it.
My name is Avnish. I'm a transplant surgeon working as a specialist in Northern General Hospital in Sheffield in United Kingdom. And I was provided with an opportunity to be an educational ambassador for ISN. And this was specifically to go to Nairobi at Nairobi Hospital to facilitate the kidney transplant program there. The transplant program there was running, but it had run into some problems because of the sudden demise of one of the prominent transplant surgeons there. And the team there felt a little bit rudderless, and that's why I came into the picture. So it was, I've been there once with the help of the ISN Educational Ambassador Fellowship, and once before that. So the experience there was quite a different experience as expected. but I'm really glad that it was quite fruitful. So we managed to do live donor transplants there. I was there only for a week to do the operating time, and that is 5 days in the week. But there was also an ability to attend the Kenyan Renal Annual Congress, where I could address the conference, and I specifically chose to choose a topic on vascular access, because that is something which is usually never touched in these sort of conferences, but it is so important for patients who are well established in dialysis and who have no transplant options, so they have to continue dialysis. So their vascular access is absolutely key and their lifeline. And the education around maintaining and creating the vascular access is quite an unfilled gap, I think, all across the globe. So I was able to give a lecture to the nursing staff there who attended in big numbers, and doctors and some surgeons, and able to demonstrate the use of ultrasound to help to detect problems. And the key important thing is the needling techniques, proper needling techniques, and to prevent the complications from that. So that's a little bit on the vascular access. And on one day in Nairobi Hospital, we actually performed some vascular access procedures which will not be operated upon in Kenya. So the use of some accesses like basiliquane has never been used there. So I was able to demonstrate that technique, and I'm hopeful the surgeons there have learned and picked up the few nuances, and have the confidence to use that for future. And we also used one graft, which is also not usually done there. So that's talking about the vascular access, but I think main crux was about the kidney transplant and live donor transplants. And these were patients who were normally very challenging. They would not normally be done. And I think one of the patients was waiting for 4 years on dialysis, and he very kindly sent a message that how his life has become so productive, and he was waiting for 4 years on dialysis, but he was not able to have a transplant because he had only had one donor, and the donor had such complex anatomy that that sort of transplant would not have been possible there. So that's about the individual benefit to a few patients. I think one patient had traveled from a neighboring country and was not able to get a transplant there. Again, very complex anatomy and high BMI, so they would not normally be able to have a transplant. But apart from individual benefits, I think the main crux was to impart the knowledge and the skills to the team there, and not just to one hospital, but the surgeons attended from neighboring hospital. I think there were at least 4 to 5 surgeons who have attended the surgeries, and they were able to pick up the techniques and to make the whole process of the transplant just much more simpler. So we started from the basics to get the pathway right. So very important to have the MDT discussion with the radiologist so that the radiology is absolutely clear before you undertake the operation, and also enhancing the pathway so that the pre-op assessment happens much ahead on the not on the day of the day before the surgery. That's what is the usual practice. So then there will be a lot of surprises will come up, and then there's a potential of cancelling, or there's a lot of panic on the last moment. So there's a lot of little bit of background on the preparation bit, which I have tried to change. In theatre, I tried to change the practices of although there's a WHO guideline which needs to be followed up for safety practice, but it was not practically followed up, so I made sure it was practiced, and I think they have picked it up, and they continue to use that now for all their cases, and to simplify the process of the operation technique. The retractors they used very complex instruments, and they were not really suitable for it, and instead of 5 instruments you would get like 20 instruments which you don't need. So just simplified the process of the operation, and they learned the techniques, And I think that there was an impact on the anesthesia as well, because that care is also very important during the operation, after the operation. So just to keep things very simple, try to not to be very invasive, and not to panic too much. I think that's the key thing as well. It was taken as a really very very big operation, and everybody is in a panic mode. But if things are simplified and they see that the surgeon here came and just did multiple vessels without any panic, with ease, and with minimum amount of extra things required. So I think that put things at ease, and hopefully they picked up. I think they did pick up most of the techniques, and I've heard good stories afterwards that transplants have been restarted in some other neighboring hospitals. The surgeons who attended, they have been successful in doing transplants in other centers. So it's not just the one hospital, but in I think the whole area, they have been adapted the techniques, and there's more transplants happening following this. And follow-up, I think they all operations went very smoothly. There was no real complications, and yeah, I think the results have been very satisfied. So I'm really pleased with the outcomes. It has been a very very satisfying experience to me personally, not just because of the individual benefits of a few patients which I could, but I think it's the team which have enabled to perform more. So this is going to affect a large amount of population which will benefit from that. And if anybody is thinking of doing this, I would say just go for it. It is very satisfying, and we still keep in touch with the team there. What we made was called a temporary transplant group, and it's still named as a temporary transplant group in WhatsApp, but it's not really temporary because we keep exchanging notes, and whenever there's a difficult complex anatomy on the angio, they will ask questions that is this right or wrong, and should we do this or not, is the recipient selection okay or not. So we still have maintained that connection and the bond, and I look forward to go back again sometime in future. I'm sure they'll be keeping some nice cases for me to perform.
Right. So excellent. Thank you so much, Avnish. I think it had a major impact there, as the host mentor will actually allude to very shortly. Before I introduce the host mentor or the host consultant, I would just like to reiterate that there is a Q&A box and there's a chat box underneath, and we will be taking questions after Dr. Khalta Soki's presentation. So if you've got any burning questions, anything related to the Educational Ambassador Program, please do reach out, and we will be taking your questions after the following presentation. So without further ado, I would like to introduce the wonderful lady who came up with the idea and who has worked so hard to get this program off the ground in Kenya. She's a renal consultant based out of Nairobi. She's the chief consultant there. She's heavily involved with the regional societies as well. And she's her main interest is critical care and HIV medicine, I believe, as well. So Dr. Khalda Soki, over to you.
Thank you so much, Ahan. And I think you could have seen me laughing at Mr. Kumar's stories. We've formed such an amazing team, and this is the team, and he's part of this team, and he says we are constantly in touch with him still. So he's part of us, and he knows that. And I think he's very calm about it. But the cases that we gave him, I think needed a lot of calm, and I didn't realize it at that time because I'm not a surgeon. I'm a nephrologist. I'm a physician, and so I called upon him, and he just stepped up, and we're so grateful to him. So maybe I'll reiterate some of the things that he said. And I am an ISN fellow myself, and I was an ISN fellow, clinical nephrology fellow in Sheffield in 2017. And so that is part of it. And as we came home, I continued to be involved in the ISN programs. We had a sister renal center program between Kenyatta National Hospital and the Sheffield Kidney Institute with Professor Kwaja, my host mentor, coming into Kenya. So we've been involved in a couple of programs before, which I think is key to build that relationship with the ISN. And the ISN, Mara attends, and Sophie usually attends, and many ISN ambassadors attend our Kenya Renal conferences on a yearly basis. And I'm so appreciative to the ISN for that. So previously, in the past, we had attempted another educational ambassadors program that was not successful. And maybe after having seen this one, I can talk about that, because we didn't really have a plan. We hadn't really sort of fully formed it out. And our application, actually, we didn't even formally end up applying. We found a way around it in talking with Mara. And we managed to do something online that worked just as well. But this time, as Mr. Kumar mentioned, in November of 2022, we actually just ended up rudderless. Because of this tragedy that happened to our team. And actually, at that point, transplant in 3 hospitals in Nairobi essentially stopped, because this was our primary vascular surgeon. He had the experience and he was mentoring others and training others. But when he passed away, so we were sort of left without a direction. And so we didn't transplant for many months, and we needed a way forward. And those he was, the surgeons that he was training were already consultant surgeons in their own right, doing their own procedures. They were cardiothoracic surgeons, they were urologists, and now just getting that extra mentorship or training in transplantation. And I think that is key when it comes to setting up a program and ensuring the sustainability of the program, because these surgeons were already experienced surgeons and they just needed that extra help. So going forward, what happened was, in order to get our transplant program kickstarted again, because we had a list of patients that now didn't know what to do. We didn't know what to do with them because they were rather complex patients and they needed a way forward. I remembered the surgeon in Sheffield and the surgical team in Sheffield, and I knew what I needed was somebody with the relevant expertise and somebody who would not panic, because he was coming in from Sheffield in the UK to an African country. He didn't know what to expect. He'd never been to our country before, and into a theater that he didn't know, into a team that he didn't know. And so I needed somebody who was very calm under pressure, as he talked about. And it's relying on those networks again that we had formed during our ISN fellowship, because I had worked with Mr. Kumar in theater while observing the transplants that they were doing in Sheffield. And so I reached out to him, and just amazingly, right off the bat, he was willing to come over and help us. And so what I did after that was, okay, I had goodwill from him. I reached out to the mentee surgeons, and I'm not a surgeon, so this was relying also on goodwill from them, that they were willing to be trained. And we had an online meeting between the surgeons and Mr. Kumar. And again, seeing that they gelled well, that they were able to communicate, and each side was willing to train and be trained. And I think this was key. And then again, we reached out to the wider team at the hospital. That was the team that you saw in the first picture. This is the team in theater on the day that Mr. Kumar came over. And reaching out to the wider team in the hospital, and that's the transplant team consisting of the anesthetist, the other nephrologists, the theater team, ICU team, ward team, the dietitians, the physiotherapists, and that's the team, the pharmacologists. That's the team that you saw in the first picture. And reaching out to them and saying, do you think we can do this? And everybody, once again, was on board, was willing. And I think this sort of multidisciplinary goodwill is really required during a program, in terms of executing a fruitful program, and also in terms of the sustainability of the program. And then after that, I reached out to the hospital administration, and that was the first time that we needed Mr. Kumar to come in March of 2023. And I reached out to the hospital administration and said, look, we need to do this. We need to kickstart our program again, we need to be able to get the team on board and just build this team once more. And I think we can do this with this gentleman who can come in from Sheffield. And the hospital, the Nairobi Hospital medical director and CEO were all for it. And in this first instance, when we needed Mr. Kumar to come down, they catered for his flight and his accommodation. And I made full use of him. He landed on a Sunday, Mr. Kumar, and we had already gone through the potential patients who were to be transplanted, coming all the way from Ethiopia and from all around Kenya. And they were complex patients. They were also complex nephrologically, physiologically. They were, one was high BMI, another one was supposed to have 2 renal arteries, ended up having 3 renal arteries when Mr. Kumar, when we opened up for the donor nephrectomy. And he was so calm. He just looked, said, okay, let's do this. And everybody in theater, because he was calm, was very calm. So what we did is he landed on a Sunday, and we had gone through the cases, but he landed and we went through the cases again, used the Monday to go through the patients who we had already admitted before. So the patients were already in hospital, met the patients, examined them, then went to theater, met the theater team for the first time, went through the equipment in theater, said what he needed, and we were prepared in that way. But of course, the proof of the pudding is in the eating, isn't it? And so on Tuesday, we had the first case, and that was the transplant case. So we transplanted on Tuesday, Wednesday, Thursday, and Friday. And as you can see on the picture over here, this is them in theater, and you can see 3 of the trainee transplant surgeons, Dr. Nikita there, who is a cardiothoracic surgeon, Dr. Mustafa, who's a vascular surgeon, and Dr. Njogu, who there you just can't see, who is a urologist, and all of them coming in to learn from him. And that's them having received the kidney and just doing some dissection and cleaning up. And you can see there on the right in the picture that we had the donor team on the left and the receiving team, the recipient team on the right, now receiving the kidney. And everybody just learned that's my mentee. That's what nephrologists do in theater, apparently observe and take photos. So, but it was an excellent experience for us. And it was very challenging to the team because we had never had so many transplants ongoing in the hospital at the same time, and all of them challenging cases, and everybody learning, but everybody willing to pull together and just make sure that this was doable. And he, as he said, changed our practices, came in the morning, have the team meeting in theater, everybody come in, surgeons, anesthetists, nurses, nephrologists, say what we think our challenges are, what we see as problems in theater today, what could go wrong, what could go right, and what our expectations are, go through our WHO checklist. And he changed all of that, and we have continued with that since he's been gone. He changed the surgical techniques, and we were able to get all of this training, and he went home on the Sunday after 1 week. So the following month, we did another 2 transplants, excellent outcome. The month after that, another 2 transplants, and we continued that way. And so in a few months, I was ready for him to come back, but we did not have the funds for that. And happily, earlier that year, when we were at the African Association of Nephrology conference, I had met Gavin, and I had met Charu Malik, and I had met Mara again, and Sophie, and we had talked about the Educational Ambassadors program. And so I reached out to them just amazingly, and they were like, let's do this. And they took me through the form. The form was simple to fill, but the form is very concise. You need a plan, you need a precise plan, you need a budget, you need to say what we're going to be able to do. And again, I think I pushed Mr. Kumar quite far, because another 4 patients were planned, and then he also came in. So he was here for 10 days this time, and I made use of him at the Kenya Renal Association conference that I was organizing. And this is a huge conference that we have delegates from East and Central Africa all coming in, about 500 attendees in a year. And he ran our vascular access workshop along with our local interventional nephrologist, Dr. Sokwala, and then went on also to give a lecture. And then that was in Mombasa, another city in Kenya. And then we flew to Nairobi now to start on transplants again. And we were able to do 3 very technically challenging transplants, now more complex, multiple vessels, again, high BMI, previous surgeries. and patients again from all over Kenya. And we did not do the last case and instead changed that to 2 vascular cases, a graft case and a brachiocephalic fistula, complex cases once again. And he was able to do this with us. And I think what he saw was the growth, as he also commented, the growth of the surgeons that he had left. Dr. Njogu has done the first laparoscopic assisted donor nephrectomy in Kenya. Dr. Mustafa and Dr. Nikita continue to transplant multiple vessels, not an issue for them right now. And he could see the growth and the sustainability also of the multidisciplinary team. We're no longer taking our patients to ICU after transplant. We're nursing them in the ward. And transplant has just moved on. We were able to, Dr. Mustafa coming from Aga Khan Hospital, able to restart the transplant program there, transplanting at another hospital, more transplants in the national hospital because Dr. Nikita now does that for the government hospital. And we were able to just grow the transplant program since then. So for me, the do's for the educational transplants were these: to have a very specific, measurable objective and a problem that you're solving for, very specific, and then to have several online planning meetings before. And these are also team building meetings because it enables the team to get to know each other. And then we had a first meeting and now a second meeting. And in this second meeting, the ISN is the one who catered the educational transplant program, catered for Mr. Kumar's flight and catered for his accommodation, and also needed input from us and goodwill from us because we took care now of his food and his transport. So it also needs that from the receiving team. And then we picking mentees who were somewhat experienced, if it was possible, and well motivated, because it was building on what they had and enabling them to continue with that after the educational ambassador left. And then I think having a champion or a coordinator such as myself, who was not part of the surgical team, but was able to see what the team needed and to be able to try and meet each one's needs and coordinate their movements, I think was very helpful. And to start by keeping it simple, I gave Mr. Kumar and the team very complex cases, and having 4 cases in 1 week was perhaps a little bit much, though I'm glad that we did it. It pushed the team. But there were a couple of moments when it was touch and go. And one of our patients did end up in ICU, not to do anything with the transplant, but because of challenges to do with vasculature and superior vena cava syndrome. These are renal patients, so they are all complex, even when they look like they're very straightforward. And these were things that we had to think about. And he was the one who actually sent the message to Mr. Kumar after he left, as we'll see. Maybe you can move to the next slide. And our achievements since then, we have 2, I think it is 3 now, vascular surgeons trained in transplanting in 4 transplant centers in Nairobi. 35 patients transplanted last year across all of these 4 hospitals. And with one program that restarted, that's the 4th hospital. And all these patients coming in from Uganda, from Rwanda, from Ethiopia, coming in for transplant, from Tanzania, coming in for transplant in Nairobi, and all of them doing really, really well. I'm happy to say 1.5 years after the program. And the advantages, of course, of being part of the ISN network, being able to reach out to this network of experts, assisting with funding, and in general, just having this pool of people with goodwill towards you and growing your program and just building the skills within our countries. So this is the team. We see there are medical director, team from theater, team from nephrology, anesthesia, and our administration, and of course, Mr. Kumar in the middle. Moving to the next slide, and just after a whole week work's done, just bonding after that. And our next slide, this was just a message sent by one of our patients that square has moved. That's from Anthony then. And we transplanted him, and he had been the patient who had actually been on the wait list for 2 years, on dialysis for 4 years, but not able to be transplanted because his donor's vasculature was very, very complex. And finally, it's Mr. Kumar who came and did that, and just he's back at work and his family and having another baby this year. And you can see down there, after all the accolades to Mr. Kumar, and for you too, Dr. Soki. Thanks, Anthony. So I guess that's that. And that was our experience with the Educational Ambassador Program, and just grateful to the ISN for this.
Thank you, Khalida, for sharing your wonderful experience with us. Thank you to all the speakers, and the session is now open discussion. So if you want, or if you have any questions, comments, would like to ask some practicalities or like general question, feel free to send us any comments. And in the meantime, we've already received some comments, and maybe I would like to start asking Vincent and Ahad, you know, you are experienced reviewers now. What is the key point, I know, to achieve a successful application? What's the really key points you are looking for? I mean, we've touched on a bit before, but if you can, you know, highlight one or two key points. Thank you.
Thanks, Zdenka, and yeah, thanks for all the talks, and Khalida, that was wonderful hearing about how transplantation has been transformed, and not only in your country but in other countries in Africa. So that's fantastic to hear, and I think that is a great example of, I suppose, what the Educational Ambassador Program is looking for, to have an application for an ambassador that can provide or the educational ambassador themselves will be an expert. I mean, that's a key thing. But the host centre will have devised a program where there will be an impact on clinical care. And that clinical care can be in lots of different things, as I think we've spoken about during this webinar, whether it's interventional, nephrology, pathology, transplantation, it can be pediatric, can be adult. I mean, the subject itself needs to be within nephrology. And we've had medical, we've had nursing input, we've had anatomical pathologists involved. So there's a lot of variety. So I think the key thing, and Khalida, you've really demonstrated this, is actually the planning in the application. And please reach out to the ISN office and to the committee. And I think, Khalida, you mentioned Mara and Sophie and others in the ISN office, and how they're extremely helpful and can help you work through the application. You know, we want, ISN wants to support host centres having educational ambassadors. Do you have other comments as well?
No, I think you've hit the nail on the head. I just largely echo what you've just said. Number one, great job, Khalida. You did an excellent job. I mean, I think this is a shining example. It is. The classical point when I am reviewing any application is largely to look at the area of need. As long as it is practical, I mean, there is a slight preference that it needs to be a little hands-on, because most of the things you can do online as well. So if it's something hands-on, and it's to do with nephrology, we would definitely try our best to accommodate and help out. And of course, it comes down to funding as well. Funding needs to be reasonable, but we negotiate with the applicant anyway. If we think, you know, this is a little too much, we're always trying our best to sort of accommodate. Number three is, of course, whoever the ambassador, educational ambassador, needs to be of a certain competence. Most of the time, I think they already reach out. They've already have a relationship with them, with a sister renal center, or they've met it at a previous WCN. So I would encourage everybody who's going to India for the WCN in 2025 to reach out. We'll have a booth there as well, and you can develop a relationship with multiple ambassadors. I saw a gentleman from Australia actually mention that he's been, he's a transplant physician since 2015 and wants to contribute as well. So, I mean, so that's the main thing, competence. And if you think that you don't have someone and you just need an area of need, just reach out to any of us, Mara, Eugene, and we do have a pool of, consultants who want to contribute, and we can look into that as well. Yeah.
Yeah, okay, thank you very much. Khalida, would you like to comment from the applicant's point of view, the key point or the key, way to successful application? I mean, you've mentioned some of it, but will I put imagine you work in a host center that, you are a shy nephrologist and would like to join the program, but you don't know where to start, what to do first.
I think actually the thing is to point out, number one, there are many, I think, ISN programs that we don't take advantage of. And it's really a lot of expertise and a lot of goodwill out there. It seems intimidating, I think, sometimes, because you'll find a whole host of like international experts. But the team is really friendly. The team is really helpful, really communicative. And I think they're amazing in the way that they support us. It's really quite amazing how fast they reach out and are able to just respond and help you and point you in the right direction. So I think we're here about the Educational Ambassadors Program, and I think people should take advantage. And sometimes it's just reaching out to say, I have this idea, do you think it will work? And actually you'll get pointed in the right direction or sorted out in some way. And I think there are other programs we should also take advantage of, the Sister Renal Center, the Sister Transplant Centers, and all of these programs just sort of combine to just sort of grow your center steadily. And I think it has made such a tremendous change to us. So I would suggest, I was really lucky to be able to meet a lot of the team when we were at AFRAD. So I just reached out to them directly. But I think I remember Mara when I was an ISN fellow, and she's just an email away and she just responds. So, and I'd never met her. And so even then, I think just going to the website, an easy email, and you will receive a response. And I think it's just get started and see where it can go, really. Yeah.
Okay, we now have received a question. Maybe Vincent, would you like to comment on that?
Okay, so the question from Dr. Casham is whether the ISN does help locate ambassadors if we specify the needs. Yeah, look, that's absolutely what the ISN would like to do. Usually the program is supporting a host center that has already got an ambassador identified through, as like Khalil, you mentioned, the Sister Renal Center partnership with Sheffield. But we do have a number of educational ambassadors that have volunteered their expertise that are available. And so, yeah, if there is a need that your host center has, then yeah, the office and the committee, the Educational Ambassador Committee, will really try to find someone that can support you. And as I think we've talked about, there are a number of ways that the ISN can support, not just the Educational Ambassador Program. There's also the Continuing Medical Education, the CME program, research and so forth. So yeah, the ISN will try to find someone for you.
Can someone who's interested, and experienced enough become an ambassador, or is there a closed list of ambassadors already? Can you comment on that?
No, of course not. I think anybody, I think you have to be an ISN member, I believe. I think that is the primary requirement. And then the other one is that, it's all about competence. Anybody can sort of apply. Of course, they do have to provide their CV, and that is sifted through a process. But I don't think there is any limitation that who cannot be. Is this in relation to the question regarding electrolyte? This gentleman, or is this just a basic question? Because there's a question in the chat as well regarding whether if somebody is interested in doing electrolyte and acid-based disorders. Is it in relation to that, Zdenka?
Yeah, I mean, it was a general question inspired by that, but you can comment from far.
Absolutely. I mean, what he's describing, he hasn't said the name, it says anonymous. So what he's saying sounds very, very exciting and something that I would like to attend for one. But the other thing is that it is an educational ambassador program. So the thing is that somebody needs to apply that they want to learn this. I want to learn this. But somebody has to apply that this is something that we are lacking at our local center. Can you guys help? And we know this anonymous gentleman that he was willing, and we can set it up for them. Yeah, that's how it works. And Mara is always there. Eugene's always there. As Khalda has already said, they're great.
Okay, thank you very much. I don't see any further questions in the Q&A session. So maybe it's time to wrap up this lovely webinar. Thank you all for being with us today. Thank you for your participation. And I will now invite all the speakers to have the final word. Thank you.
Right. If I may, before I hand it over to our chair. Firstly, thank you so much, everybody, for joining in, all the speakers, Haldas, Denka, Eugene, Mara, and Vincent. You've been great. Thank you so much for sparing time for us. Just a couple of things. One thing I just highlighted earlier, this is the program that is 365 days a year. So if you have an area of need, you just don't, there's no deadline. So you just have to reach out, go to the link. We've already put it in the chat box, and just visit the website and reach out to Mara or Eugene, and we will be there to help you out. If there's any further questions, you definitely can reach out to her directly as well. We will be at the WCN in Delhi. So yeah, of course, go come and meet us at the booth. I think Eugene's also shared a link in the chat box regarding travel grants or grants. So do explore that. Over to you, Vincent.
Thanks, Ahad. Yeah, and so yeah, I hope that this webinar has been very helpful for those in the audience to know that, you know, ultimately this program is for ISN members. We are ISN members as well, and so the program is for you. And so if you have any questions, any queries, please reach out to the program, to the program coordinators, to the ISN office, even if it's just to have an inquiry. Even if you don't have a specific program like all knitted together, and we can look at that. And yeah, hands-on programs are great, and you know, we would love to support even more programs in the future. Thank you.